Hello everyone, welcome to Health and Paramedical Department of PSS Central Institute of Vocational Education. Today we are going to refresh our knowledge regarding Ryle's tube. In this video we are going to cover introduction of Ryle's tube, color code and French of Ryle's tube, indications of Ryle's tube, last but not the least, procedure of Ryle's tube. Let's start with the introduction of Ryle's tube. Ryle's tube is also known as nasogastric tube. This is a thin and flexible tube which is inserted through the nose into the stomach. Let's start the color code and French of Ryle's tube. Light green color 6 French, blue color 8 French, black color 10 French. These 3 Ryle's tube used for the infants. Next, white color 12 French, green color 14 French. These 2 Ryle's tube used for the children. Orange color 16 French, red color 18 French, yellow color 20 French. These 3 used for the adults. Let's start the indication for the insertion of Ryle's tube. We use Ryle's tube to provide liquid food and medication to the person who is unable to take orally. We use Ryle's tube to withdraw fluid from the stomach. We also use Ryle's tube to decompress the stomach if intestine is obstructed. We use Ryle's tube to provide fluid to the paralysis patient, oral cancer patient. It is also used in ventilated associated patients. Let's start the procedure of Ryle's tube. Let's start with the equipments. We need Ryle's tube, a septo syringe, stethoscope, xylocaine jelly 2%, adhesive tape and cotton pad. We also need a tongue depressor. Let's start the procedure. First, explain procedure to the patient and provide semi-upright position. Second, remove all your jewelries, wash your hands and wear PPE kit. Let's start the procedure. You should never touch directly to the tube. You need an assistant and you need to follow a aseptic technique. Let's start the measurement of Ryle's tube. Put the tip of Ryle's tube into the upper lips and into the earlobe. From earlobe to the xephisternum of the stomach. This is an approx distance between the nose and stomach. Let's start the procedure. Insert Ryle's tube slowly through the nose of the patient and ask patient to swallow it. If patient is unable to swallow, he is resisting, offer him sips of water to swallow. During procedure, use tongue depressor to see the coiling of a tube into the mouth. When you insert tube, it fixed with the adhesive tape. Now we are going to the placement of the tube. We will check the placement of tube by putting 30 ml of air into the tube and checking with the stethoscope the sound of air into the stomach. Or another process, we can aspirate the gastric fluid to check the placement of Ryle's tube. Commonly, these things are used to check the placement of Ryle's tube, but we should never use these procedures because sometimes they can be harmful. The confirmative test for the checking of placement of Ryle's tube is X-ray. So today we learn the procedure of Ryle's tube. It is a demonstrative procedure. I hope you like this video. Thanks for watching.